And now this, 450,000 of the state's most vulnerable children and pregnant women may lose access to some of the top pediatric providers in the state.
Yeah, patients on Medicaid, you need to listen up. Health reporter Haley Hernandez is here to explain how this drama that is unfolding could put your health in jeopardy.
Yeah, because a lot of children and moms in our area who are on Medicaid may lose access to their doctors in 2025. Many of you don't even realize it yet because the contract to make that deal to secure your benefits is in dispute right now.
Drastic changes could be coming for about half of Texans on Medicaid, like Amanda Navarrete, who uses the Texas Children's Hospital STAR program. She would be forced to find a new doctor.
If it's taken away, I will definitely be struggling having to cover the costs of taking care of my daughter and taking her to her appointments.
We're obviously very disturbed about the potential outcome.
This is Michael Murphy, president of the Texas Children's Health Plan, and he's outraged by what seems to be coming down the pipe.
When you find somebody you can work well with to really navigate the healthcare system effectively, then you have to break that bond and go find somebody new and start all over that process. That is highly, highly disruptive to everybody's personal lives.
Some Medicaid patients may be able to find other providers or go to another hospital system, but what Murphy is referring to are the mothers of children with disabilities who've built an entire medical team and in some cases have specialists who may only exist at Texas Children's.
You know how long it takes, take you yourself, for example, how long does it take you to get an appointment with a specialist? It takes a long time.
Yes.
Now, when you have a high dependency where you need to see that specialist on a regular recurring basis at a high frequency, that's very, very difficult to manage. And when you break the connection, it allows you to keep that cadence in place, to keep the care you need in place in the time that you need it. And you have to start all over from the beginning. That's a very, very tough thing to do. And the kids are going to suffer as part of that process. And that certainly isn't acceptable.
And affordable? Forget about it. Amanda works part-time at $16 an hour. And then when she had postpartum complications, she realized not having access to care would have cost her life.
I had migraines for like 4 days straight, and it would not go away. She was like, we need you to go to the hospital like now. And I wouldn't have caught that. I would not have caught that without her. I just pray that this can really continue because it blessed me, it blessed my life, it blessed my daughter. So I pray that it does continue.
The state essentially believes that they know better than the members themselves who the right providers and the right health plans are for them. That certainly isn't actually the case. The state is trying to do what they believe is in the best interest of the state. I think there's a fair number of unintended consequences with this particular decision. It's not like we're buying staplers. We're actually taking care of kids' health care and adult health care for expectant mothers.
Now, affected Texans would be shifted to new insurers next year if State Health and Human Services sticks to its plans. And here's what the agency told me about their plan. Although the request for proposals has been posted, responded to, and evaluated, it remains an open procurement until all protests and appeals submitted by respondents have been resolved. And it does get a little more complicated than that. Also, a lawsuit has been filed. So to see all of those details, plus the full statements from all sides, go to click2houston.com.
All right, Haley, thanks for that explainer.